My name is Desiree Naylor, and I am the Community Service Lead for Alberta, here with the Leukemia and Lymphoma Society of Canada. And today, I'll be the moderator of this online event. We invite you to type your questions and comments in the Q&A box of your Zoom webinar panel throughout the presentation. An LSC staff member will be monitoring the questions, and I will read some of the questions aloud at the end of the presentation. Due to the large number of participants and limited time, we may not be able to answer all your questions. Also note that our speaker cannot answer specific questions about a person's personal health or status. If we do not get to your question during the live presentation, a community service lead will contact you in the coming days. Today's presentation will be recorded, therefore, you can rewatch it again on our website. Next slide, please. Wonderful. Are you looking for specific programs or resources, but not sure where to find them? We are here to help. You can connect with the community service lead in your area to receive personalized assistance in finding answers to your questions and get connected to resources in your area. You can reach out to us by calling toll-free at 1-833-222-4884. Next slide. And we invite you to visit our website, bloodcancers.ca. Our goal is to better serve the community and offer an improved experience. On our website, you will find tailored information, including a section of the website dedicated to resources to help manage fatigue and cognitive challenges. Next slide. Some of these resources include podcast episodes, fact sheets, and worksheets designed to help manage the burden and inconvenience caused by fatigue and brain fog. You can visit bloodcancers.ca to download these resources. Next slide. Did you know that the LSC has an app where you can track your symptoms, side effects, and much more? Download the free Health Manager app to help better manage your blood cancer diagnosis and side effect trackers. Plus, there's a shared caregiver access. This app is available for Apple or Android devices. And next slide, please. Perfect. Well, it's time to introduce today's speaker. Kendra is a registered nurse and allogenic blood and marrow transplant coordinator, working with patients who have leukemia and other hematological diseases at the Cross Cancer Institute in Edmonton, Alberta. Kendra has a keen interest in oncology and hematology and caring for the unique needs of this patient population. Thank you so much, Kendra, for being here today. I will pass it over to you.
Thank you all so much. It's such a pleasure to be here today with everyone. Let's get started. I went to bed, slept normally, and woke up still feeling extremely tired. Just getting out of bed and showering in the morning feels like I ran a marathon. I noticed myself getting more and more tired, but I just put it down to getting older and my new cancer diagnosis. If you or a loved one has ever said statements like these, they may be experiencing one of the big F words in cancer care, cancer-related fatigue. Many patients and survivors may not know there is a word for how they are feeling, but they are seeking for ways to overcome it. In this presentation, we will discuss the two big F words in cancer care, fatigue and brain fog. Learn how to manage cancer-related fatigue in day-to-day life, identify self-management techniques to improve cancer-related brain fog, and determine ways to conserve energy to optimize your emotional and physical well-being. Everyone from time to time feels the lack of energy that fatigue can bring. Fatigue is simply the body's natural way of showing that rest is needed. I just need a good night's sleep, is what most people think to themselves when they feel tired. But what if rest and even a full night's sleep does not seem to combat the tiredness? In fact, it keeps coming back or getting worse. Exhaustion that lasts for prolonged periods of time is not normal. However, For patients with cancer, it is a common occurrence. Cancer-related fatigue may even be a patient's first sign or symptom of cancer. What is cancer-related fatigue? It's a persistent sense of tiredness, whether physically, mentally, and/or emotionally, that interferes with usual day-to-day functioning. It's a feeling of lack of energy, which is not linked with recent activity or effort. It is more severe and lasts longer than any other fatigue you may have had before you had cancer. Rest may not result in improvement. It can occur at any time before, during, or after cancer treatment. What are some signs of cancer-related fatigue that you may notice in yourself or your loved one? Feeling of exhaustion. This includes physically, emotionally, spiritually, and/or mental exhaustion. Your body and limbs may feel heavy. You have less desire to do normal daily activities like eating or grocery shopping. You feel like you don't have the energy to socialize. You may find it difficult to concentrate or to think clearly. This can be known as brain fog. Fatigue can cause patients to avoid or skip treatments. It can also negatively affect various areas of life, such as relationships and work. If you have noticed any of these symptoms of cancer-related fatigue, you are not alone. Fatigue is the most common symptom reported by cancer patients and survivors. For many, it can be the most troubling symptom of treatment and the most disruptive side effect of all. It affects 70 to 100% of cancer patients. 30 to 75% of patients have reported it in months to years after treatment. Assessing cancer-related fatigue can be challenging. Therefore, good communication with your healthcare team is key. Fatigue can fluctuate throughout the day and between treatments. Distinguishing between other issues like depression or anemia may be challenging. Patients or survivors may not mention it to healthcare providers because they believe it's just an inevitable part of cancer and treatment. There are several medical and non-pharmaceutical interventions that may help restore energy. Some questions your doctor may ask or topics you may want to bring up are: when did you begin experiencing fatigue? Has it progressed since your diagnosis? How severe is it on a scale of 1 to 10? How long does it last? What makes it worse? What eases it? How does it affect your daily life? Do you experience shortness of breath? How well are you sleeping? How and what are you eating? How are you feeling emotionally? Are you experiencing changes to your memory or ability to focus? Keeping a journal of symptom information for your healthcare team to assess and monitor will be beneficial. All types of cancer and cancer treatment can cause fatigue because your body's immune system is working hard to fight the disease. What are some potential causes of cancer-related fatigue? Cancer treatments, such as radiation therapy, immunotherapy, chemotherapy, and surgery, and their side effects. You may experience fatigue if cancer treatment damages healthy cells in addition to cancer cells. Your body will use energy as it works to repair cell damage caused by treatment. These treatments change how cells work, cause inflammation. They can make you nauseated and dehydrated, change hormone levels, damage tissues and cells, reduce blood counts leading to anemia and infections, and stimulate the production of cytokines, which are toxic cell proteins. Patients treated with systemic chemotherapy usually feel the most fatigue in the days right after each treatment and decreases until the next treatment. Some studies have shown that patients have the most severe fatigue midway through their chemotherapy treatment plan. With radiation therapy, It can cause cumulative fatigue that increases over time and can occur regardless of the treatment site. It usually lasts from 3 to 4 weeks after treatment stops, but can continue for many months after. One study of stem cell transplant long-term survivors reported up to 44% had persistent moderate to severe fatigue, even though they were cancer-free. Other causes, emotional distress. When you are stressed, your heart works harder. Your body floods with hormones, including the stress hormone cortisol, and you enter fight or flight mode. All the increased activity of your sympathetic nervous system takes a toll on your body, causing exhaustion. Medications, for example, side effects from medications can cause fatigue by affecting your ability to sleep, or they may cause drowsiness. Sleep problems, whether from treatment or pre-existing, cancer itself, blood and marrow cancer patients may experience fatigue as a first symptom to occur because their disease can cause anemia by preventing the bone marrow from producing blood cells efficiently. Fatigue before treatment, pain, depression, or anxiety, nutrition issues or dehydration, lack of physical activity and exercise, being an older adult, or other medical comorbidities. Cancer-related fatigue isn't something that can be cured or fixed, but it can be managed. With all the potential causes for cancer-related fatigue, and with it being such a common symptom, knowing how to help manage cancer-related fatigue is important for physical and mental well-being. What are some suggestions you may have heard when you feel exhausted? Maybe rest up or take it easy. It is difficult to be active when you feel tired, but with cancer-related fatigue, increasing your rest can actually make your fatigue worse. Physical activity is one of the best ways you can manage your fatigue. Exercise boosts oxygen circulation to support cell energy production and increased endorphin levels, the energizing happiness hormone. Regular, mild to moderate activity can boost energy levels, elevate mood, and reduce fatigue. It can also help boost your appetite, help you get better sleep, build stronger muscles and endurance, and give you a feeling of overall improved well-being. Let's discuss some practical tips for being active during or after cancer treatment. Choose a fun activity that suits your health and fitness level. Start slowly. Try light exercise like yoga or swimming. Try a mix of aerobic activities like cycling and walking, and strength training like lifting weights and using resistance bands. Split sessions into shorter lengths if needed. Aim to get 30 minutes of exercise on most days. Go at your own pace and increase the amount and difficulty of exercise gradually. Think outside the exercise box. Play with children, dance, window shop, use stairs, rake leaves, or shovel snow in most parts of Canada right now. Sit instead of lying down to rest. Perform bed or chair exercises. Exercise with a friend or pet. Keep a diary and jot down activities, time of day, and how you felt. Tracking your activity and fatigue will help you identify patterns and which activities and times of day affect energy levels. Most of all, don't be discouraged on difficult days. Always ensure to be safe. Always talk to your healthcare team about how to incorporate exercise safely. A referral to a physiotherapist, occupational therapist, or rehab specialist may be required. Stop and take a rest if you feel sore, out of breath, or have other adverse feelings of overactivity. Exercise at the time of day that works best for you. The best time of day for activity can be varied for each person. For you, it may be after a rest, or medications to ensure that symptoms are most under control before activity. Or on the flip side, if medications make you drowsy, this may not be the safest time. A second element of managing cancer-related fatigue to consider is nutrition. Cancer patients can be at a risk for poor nutrition for many reasons, including cancer treatment side effects and the cancer itself. Patients require about 20% more calories and protein than a person without cancer to help combat weight loss and muscle breakdown. Eating well is a great way to give your body energy. Protein provides the amino acids needed for building your cellular structures and enzymes. Carbohydrates are used to create the energy your cells need, and fat is critical for nourishing your cellular membrane structure and function. There are many dietary factors that have an effect on fatigue. Fatigue can also play a role in dietary challenges for patients and survivors. Exhaustion can prevent patients from making healthy eating a priority. Dietary factors which can increase fatigue are inadequate protein. Protein is important for healing. Meat, fish, milk products, and beans are good sources of protein. A dietitian could suggest protein supplements or meal replacements. Dehydration. It is important to consume enough fluids. Dehydration can make fatigue seem worse. Aim for 2 to 3 liters a day. Skipping meals and inadequate calories. You may find that soft foods such as soups or smoothies require less energy to eat. Be sure to make every bite count. Increase your calories by eating nutrient-dense foods and by adding cheese or butter. Dipping your fruits and veggies in yogurt or nut butter. Choosing higher fat dairy products or choosing fruit canned in syrup. Iron. Iron is important for delivering oxygen to your cells to create energy. Low iron or anemia can be a result of your disease or treatment. Be sure to talk to your doctor before starting a supplement. Adding food sources such as organ meats, clams, chickpeas, beans, and seeds, along with consuming vitamin C to help absorb iron is suggested. Involuntary weight changes. Request a consult with a dietitian to address weight loss, low appetite, or a condition that restricts what you can eat. Limiting foods and drinks high in sugar or caffeine can be helpful to avoid spikes in energy and then crashes. These foods and drinks can also affect sleep. If consumed, use them to your advantage during your day to get some of your tasks completed during an energy spike. Healthy eating tips. Choosing healthy food options and adding variety to your meals can increase energy. Utilize the Canada Food Guide. Consider trying new fruits and vegetables or protein alternatives that you haven't tried before. Did you know that artichoke hearts and pumpkin seeds are both high in protein? Cook when you have the most energy during the day. For example, prep meals or snacks early in the day if your energy tends to trend downward as the day goes on. Throughout the day, try to eat smaller, more frequent meals and snacks. Side effects like nausea or lack of appetite might make getting in your daily calories during meal times challenging. Keep extra meals in the freezer for more challenging days. Smaller portions of frozen meals are nice when your appetite is low or taste changes occur. Plan use of leftovers. For example, make a protein and use it in multiple meals. Purchase healthy, convenient items such as pre-cut fruits and vegetables or ready-made meals. Eat whenever you start to feel hungry. Keep in mind this may not line up with normal meal times. And breakfast foods are great options at any time of the day. Sleep and rest. With cancer-related fatigue, sleep and rest does not always relieve the fatigue. However, it is important to take the time to relax and practice good sleep habits. Sufficient sleep is an important element in physical and mental health. Scheduling some rest in your day can help conserve energy for when you need it. We all know that getting good sleep can give you more energy. However, it's common for people with cancer to have challenges with sleep. There are many reasons why sleep can be affected throughout a cancer diagnosis, including side effects to medications like steroids causing insomnia or worry that keeps you up at night. If you are sleeping less at night, or if your sleep is interrupted frequently, you may experience increased fatigue. If you are having difficulty falling asleep or staying asleep, be sure to discuss with your healthcare providers. They can assess your needs and may have suggestions such as taking your steroids earlier in the day to potentially decrease impact on sleep, or they can refer you to a psychosocial team member to assist with the worry. Some general tips to improve your sleep habits include: in the morning, wake up the same time each day, even on weekends. Open curtains or go to a bright room once you wake up. During the day, rest in a room that is not your bedroom. Naps should be less than 1 hour. Limit alcohol and caffeine later in the day. In the evening, set a time in the early evening to clear your head, a time for planning, worrying, and problem solving. Relax by lowering the lights. Do calming activities like reading, listening to music, or having a warm bath. Turn off all screens at least 1 hour before bed. At night, use your bed for sleep and intimacy only. If you can't fall asleep after 20 minutes, get out of bed and do something relaxing until you feel sleepy and then try again. Only go to bed when you are feeling sleepy, regardless of what time it is. Managing stress. Dealing with a cancer diagnosis creates many changes in one's life. Stress is how your body responds to change. When you experience change, your body uses energy to adjust or adapt, which in turn compounds fatigue. Stress is related to your diagnosis, relationship changes, and treatment symptoms can also change throughout diagnosis, treatment, and after treatment. Coping with and managing your emotions related to these changes are as important as managing your stress. Some tips to help manage stress. Know your stress signs. The ability to notice signs of stress early can help you decide what you need or what to do in response before your energy reserves deplete or you are unable to cope. Exchange your stress. Try not to let your stresses pile up. Try exchanging them by making room for it. For example, delegate meal preparation tasks to family or friends the day of treatment, as to ensure you will have the option to eat well on busy days. Focus on positive things and aspects you can control. Focusing on gratitude does not mean you need to stay positive all the time. This is not realistic or healthy. Taking the time to reflect on something positive in your life can help to make you feel better. Consider talking to a professional about your stress and emotions, such as a counselor or spiritual care provider. Talking to someone you trust about your feelings and doing activities to help cope with stress and anxiety can in turn help decrease your fatigue. Practice mind, body, or complementary and alternative medicine. Common examples of complementary and alternative medicine are mind-body practices like meditation, hypnosis, or art and music therapy, or yoga. Always discuss alternative medicine interests and practices with your hematologist, as some may interfere with treatment. Other examples are biological-based medicine, such as natural health products, manipulative and body-based practices such as massage therapy, energy therapy such as Reiki, and whole medical systems such as First Nations traditional healing. And join a support group. Support groups bring together people who are going through or have gone through similar experiences. For example, the Leukemia and Lymphoma Society offers virtual support groups across Canada. Seek out cancer-related fatigue education classes offered through local cancer hospitals or community-based support centers for people living with cancer. Here in Alberta, Energize is a cancer-related fatigue education class offered through the Cross Cancer Institute. And Wellspring Canada offers in-person and online classes and support groups for topics such as cancer-related fatigue, stress, and brain fog. How are cancer-related fatigue and brain fog related? A decreased attention span and difficulty understanding and thinking can be a result of cancer-related fatigue. Cognitive changes after cancer treatment are often referred to as cancer-related brain fog, chemo fog, cancer-related cognitive impairment, or chemo brain. These interchangeable terms are used by cancer patients and survivors to describe thinking and memory problems that can occur during and after cancer diagnosis and treatment. Some cancers and treatments can result in changes to thinking, learning, processing, or remembering information. Symptoms can occur suddenly or gradually and may be minor and resolve or be noticeable and irreversible. Cancer-related brain fog is not dementia or Alzheimer's disease. Other medical conditions may mimic brain fog. I walked into a room and forgot why I went. I made a list of items so I wouldn't forget what I needed, and then I forgot to take the list to the grocery store. I used to be able to talk on the phone and fold my laundry. Now I can't seem to multitask like I used to. These are all common symptoms of cancer-related brain fog reported by patients and survivors. It is often reported as the most common and distressing symptom reported by cancer survivors due to its impact on daily functioning and daily quality of life. Changes to attention, thinking, and memory are just as important as other symptoms during treatment. Be sure to report changes in symptoms to your hematologist and care team. A range of symptoms and severity can occur, some more distressing and disruptive than others. Commonly reported symptoms of cancer-related brain fog are fluctuating alertness, disorientation to person, place, or time, difficulty concentrating, reduced level of consciousness, problems with comprehension or understanding, unusual sleep patterns, agitation, confusion, or sedation, memory loss, change to personality, poor judgment and decision-making, difficulty setting boundaries and completing tasks. The cause of cancer-related cognitive problems are still being studied. Its exact cause isn't always known. Although commonly referred to as chemo brain, it is unlikely that chemotherapy is the only cause of these problems. It's most likely multifaceted. Patients who do not receive chemotherapy also report having these problems. Some causes may include effects of treatments, radiation treatment to the head and neck, the use of immunotherapy to boost the immune system, high-dose chemotherapy, hormone therapy, and other medications, cancer involving the brain, other conditions or symptoms related to cancer or cancer treatment, stress, anxiety, fatigue or depression, inflammatory processes, DNA damage, deregulation of the hypothalamic, pituitary, adrenal axis, and hormone changes. There's no single test for cancer-related brain fog. Healthcare providers may do tests to rule out conditions that may cause cognitive symptoms. Your healthcare providers choose the treatments that they expect will treat your cancer. They know some of these treatments may affect your memory and your ability to concentrate. They'll work with you to reduce those side effects as much as they can while effectively treating your condition. Managing brain fog. The severity of symptoms of brain fog can often depend on age, stress level, history of depression or anxiety, access to emotional and psychological resources, and coping abilities. Patients report temporarily worsening of symptoms during time of increased stress, stimulation, or distraction. Brain fog can impact patients and survivors' lives in many ways by causing frustration and being disruptive to functioning and relationships. It can have a significant impact to self-esteem, social relationships, ability to work, impact on quality of life, and decreased well-being. Commonly, cancer-related brain fog co-occurs with other symptoms such as fatigue, depression, and anxiety. Treatments for brain fog. There are currently no medical treatments for cancer-related brain fog. Symptoms may be managed with changes in behavior and adopting coping strategies. Whether cognitive changes will improve or will be permanent can be dependent on their cause. Acute cognitive changes that occur because of medication side effects will often improve when you discontinue the medication. Chronic cognitive changes are often not reversible, but management of long-term problems may include seeking out cognitive rehabilitation and training to help improve cognitive skills and to find ways to cope with cognitive problems, occupational therapy, and vocational rehabilitation to help with the activities of daily living and job-related skills, or use of prescribed medications. Practical tips for coping with brain fog. Use external aids. Use notes, reminders, and a daily planner. This can be a pen and paper or your smartphone to help track important dates and tasks. Use timers and alarms. Use the oven or stove clock or kitchen appliances with built-in timers and safety features like automatic shutoff. Place reminders around your house and workplace to jog your memory of important tasks. Sticky notes on a bathroom mirror or in your car of reminders for the day can be helpful. Keep important information and emergency contacts in a notebook or smartphone to carry with you. Safety is very important when it comes to coping with cognitive changes, as it can be unpredictable when a more difficult day may occur. Use pill organizers for medications and alarm reminders for medication timing. Pharmacies can assist with medication management. Take photos of what you need to remember using a smartphone. For example, of where you parked your car. Use your phone features to your advantage. You might need to ask a child or grandchild to assist with this. When tasks become habits, the brain starts to implement them with less cognitive effort. Keep your things in the same place and eliminate clutter. For example, keep your keys in a designated spot. Use repetition or tricks such as rhyming or singing to help you remember things. When coping with brain fog, don't be afraid to ask questions or re-ask at your doctor's appointments. Have a friend or family member with you at appointments to take notes and help you review details. Ask your friends or family to assist with reminders or queuing. Ask for help with daily tasks if needed. Talk to your employer if you're having issues at work to discuss ways they can support you. This may include modifying your workload and deadlines. Join a support group. You are not alone. Brain fog is common. There are many intriguing digital innovations and practical research studies being conducted related to cancer-related fatigue and brain fog. An app studying the cognitive symptoms associated with chemo brain. The app uses games and puzzles to investigate focused attention, spatial perception, short-term memory, cognitive flexibility, processing speed, and response time. There's apps that help to organize and manage treatment information and track symptoms, which can be especially helpful with memory issues from treatment. For example, the LLSC Health Manager app. An app to look at music therapy's impact on the brain after cancer. The app collects research data on music-based interventions to specifically address chemo-related cognitive deficits. And digital puzzles and games. There is ongoing research about digital puzzles and games and the positive impact to memory and cognition for people of all ages and varying health status. Digital resources can be free, accessible, and convenient with varying levels of difficulty. For example, Wordle is a simple word game that became something of a phenomenon at the start of 2022. Word puzzles are a great way to get a quick daily mental workout. What can you do to make the most of your time and energy to optimize your emotional and physical well-being? The goals of energy conservation are to complete more activities with less effort required, to find a balance between rest and the energy you must use to achieve activities of daily living, and to help you continue participating in activities that bring you joy and meaning. So let's make a list. Think about your typical daily and weekly activities and make a list of each of these topics. Energy cultivating activities. Think of activities you do and or could do that would help you cultivate and bring you energy. These are nourishing activities that lift your mood, increase energy, and help you feel calm and centered. Energy cultivating activities will help you write your own activity-based fatigue prescription. Energy depleting activities. Think about what activities deplete you of energy. These depleting activities lower your mood, drain energy, and increase stress and tension. Reflect on and try to understand the reasons why the energy depleting activities drain you. These activities will require adaptation to avoid excessive energy depletion while dealing with cancer-related fatigue. Look at your lists. Can you add more nourishing activities? Can you reduce your depleting activities? Can you reframe or adjust the depleting activities to nourish you at the same time? So once you complete your list of tasks that are energy depleting and energy conserving, use the 7 principles of energy conservation to achieve your energy depleting tasks. Number 1, schedule. Plan ahead. Balance your daily activities that use little energy and activities that use more. Create a list of daily and weekly activities that need to be completed. Rank the priority of these tasks and complete the high priority activities when you have more energy. Number 2, pace. Move at a comfortable pace or speed. Alternate heavy and light work and plan for rest periods. Number 3, delegate. Ask for help with the activities that are difficult, are not meaningful to you, or ones that use a lot of energy. Make a list of people or community resources to reach out to. Neglect. Perform activities less often, like dusting, less thoroughly or differently, like choosing ready-made meals more often, or not at all. Leave the bed unmade. Number 5, sitting. Complete activities from a seated position to conserve energy. For example, sitting on a stool to shower. Number 6, simplify. Organize items close to where they are used, at waist height when possible, to minimize bending and lifting. Switch to lightweight tools, wheeled carts, or to utilize technology such as dishwashers. Adapt your environment or activity so that you can make the task easier or use less energy. For example, keeping 2 sets of items you use often in convenient spots. And number 7, rest. Plan rest periods. Several shorter periods are better than 2 or 3 longer rest periods. The following are ways caregivers can support someone with cancer-related fatigue and brain fog. Encourage physical activity, offer to assist with day-to-day tasks, help with self-management strategies and encourage a loved one to maintain independence, help plan activities to balance energy cultivating activities with energy depleting activities. Encourage rest and good sleep routines. Respect loved ones' limitations and that symptoms can change throughout the day. Offer to accompany to appointments and take notes. Encourage open communication about symptoms and feelings. Increase your own awareness of cancer-related fatigue and brain fog, and share your knowledge with other friends or family members. What is good for the heart is good for the brain. Make physical activity part of your daily routine to help combat fatigue, increase mental alertness, cognitive functioning, and help overall mood. A balanced diet of fresh fruits, vegetables, whole grains, and protein are necessary in maintaining physical and mental well-being. Studies show that eating more vegetables are linked to preserving brain power as people age. Stay hydrated by drinking plenty of fluids to combat the negative side effects to your body and brain from dehydration. Incorporate plenty of rest into your day. Being well rested makes it easier to concentrate, learn, and remember. Practicing good sleep habits will provide more energy to fight fatigue and help rest the mind. Exercise your brain with crosswords or puzzles, painting, playing an instrument, or challenging yourself to learn a new hobby. Stress can cause mental and physical fatigue. Participating in a peaceful activity that you find pleasing can relax your mind and bring back mental energy. Cancer-related fatigue and brain fog are common symptoms patients face throughout their cancer journey and are ones that can remain in survivorship. We have discussed ways to manage cancer-related fatigue in day-to-day life and self-management techniques to improve cancer-related brain fog. I hope patients can optimize their emotional and physical well-being through use of these practical tips, energy conserving techniques, and with caregiver support. I hope that cancer-related fatigue and brain fog will become less distressing F words in your cancer care journey. Thank you. These are just some references.
Ooh, thank you, Kendra. That was great information. And thank you so much for sharing your expertise and insight on such an important topic. Like you mentioned, there is a large number of individuals with a blood cancer that will experience one of these two things. So thanks again for being a part of this conversation today. It is now time for our question and answer period. If you haven't done so already, please be sure to use the Q&A box in your Zoom webinar panel to type in your questions. And as mentioned earlier, just due to the large number of participants and our limited time, we may not get to all of the questions. And if we do not get to your question today, community service lead will connect with you in the coming days. So we do have a couple of questions that I'm going to combine together because they were all related to does fatigue and brain fog change with time? So for example, is it possible to still have some degree of fatigue or brain fog maybe 10 years after treatment? And will it go away after, say, a stem cell transplant?
That is a great question, and one that I'm sure everybody wishes that the answer was it will go away 100%. But as discussed in the presentation too, it is really unpredictable how long that brain fog and fatigue may last. For example, the reasons why it may be caused may affect the length as well. So people who have went through stem cell transplant and the preconditioning that may include myeloablative chemo and total body irradiation that directly affects the brain may have more long-standing fatigue and cognitive challenges. That also will include how much support they have after treatment, of how long some of these things may last. But again, if it's lasting longer than you feel comfortable, talking to your healthcare team is so important that there may be medications or other things that they could determine that would help. So looking at blood counts, whether there is deficiencies in your nutrients that could be replaced, for example.
Perfect. Kind of leads me into my next question of how can you tell that the blood cancer is causing the fatigue and not something like normal aging or dementia?
So these are perhaps two types of topics because people probably want to know the difference between brain fog and other brain issues like dementia or memory loss. We're saying that the key difference is that diseases like dementia and Alzheimer's disease affect more than just memory. They change your ability to function in your daily life. So the key differences are the timing of the symptoms. Natural memory loss can occur slowly over time and gradually worsens. Our hope is that with cancer-related brain fog and fatigue, that it will slowly get better. Recalling memories when prompted or given time to think over things, patients with chemo brain are often able to remember things they're familiar with. But with age-related memory loss or other disorders, they aren't able to recall basic information. A patient with chemo brain may recognize familiar objects and their names, and patients with memory loss disorders may use the wrong words for something or jumble the words. And essentially, the longer you're exposed to chemotherapy, the more likely you may experience chemo brain. But the good news is that patients tend to feel back to normal as treatment ends, and that will decrease. For the stem cell transplant, as we were talking about, or for anemia, if you correct the anemia, you may get that feeling of energy back. So that's why your healthcare providers will follow your blood counts very closely.
Wonderful. So one of the questions that did come in is clumsiness a side effect of brain fog?
Yes, for sure. This can be associated with brain fog and the causes of brain fog. So brain fog is not a disease itself, but rather a signal that something is off. So there is a wide range of cause for clumsiness, many that can cause brain fog, for example, cancer involving the brain. However, many cancer-related symptoms are much like the chicken and the egg analogy. So which came first? whether it is something causing brain fog or brain fog causing the clumsiness.
Perfect. Thank you. And then a comment here. So you did talk a little bit about, caregiver support. And so somebody just mentioned that sometimes our loved ones need to understand our brain fog and the behavioral issues that may come with it. It's like you almost need a business card that explains that to people. If you could, kind of sum it up in like a couple of sentences, what should somebody who is experiencing brain fog, fatigue, what can they say to their loved ones about what they're feeling?
It definitely can be a difficult topic to bring up. It can be embarrassing that you're forgetting things. And when we think about cancer and cancer treatments, we tend to think about hair loss and struggling with nausea, and many of the other kind of more stereotypical side effects of treatment. And there's not always a lot of talk about cancer-related fatigue or brain fog. And even talking about this, some people may say, well, I have many of those symptoms, so and deal with it. But just letting your loved ones know that this is an actual symptom of treatment and of cancer itself, and just to respect it in any way as nausea or vomiting that is distressing, and just support in any way as possible, helping with the tasks of daily living that may not just get done, and that it's not something that you will just snap out of. From day to day, it can last for a very, very long time.
Wonderful. So we'll take one last question. This one might be a little bit difficult, so sorry. But genetically, does this kind of condition, does it pass on from parent to child? So if you experience brain fatigue, brain fog, if your child has, cancer, will they also have it?
So with it not being a diagnosis itself, it's a sign and a side effect of treatment, that the genetic components wouldn't be applicable. But that being said, there's lots of research being done on causes or increased risks of getting cancer-related brain fog in particular, and looking at enzymes within the brain, within the body. And so I can't definitively say that there won't be something that will genetically be determined, but there is lots of work and research going on, and which hopefully will help maybe even prevent cancer-related brain fog in the future.
Wonderful. Ooh, thank you so much. I'm going to get you to move on to the next slide for me. And just a reminder for everyone who is in our webcast today, the recording will be available at the end or in the next couple of days. It will also be posted on our website and our YouTube channel. But before we sign off, I would like to remind everyone of some upcoming conferences sessions this week. So we do have 2 coming up for tomorrow. The first one is Managing the New Normal of a Chronic Blood Cancer Diagnosis. And then the second one is Infection Prevention, Staying Healthy During Cancer Treatment. On Thursday, we are hosting Blood Cancer and Spirituality. And then in December, we have new treatment guidelines for chronic lymphocytic leukemia, so CLL. Next slide, please. Perfect. Thank you. We would really like to thank all of our sponsors: AbbVie, AstraZeneca, BeiGene, Bristol Myers Squibb, GSK, Janssen Pharmaceutical Companies of Johnson & Johnson, Jazz Pharmaceuticals, and Kite Gilead Company for their support in making these conferences happen. And then next slide, please. Please remember that we are here to help you. You can reach us by email, by visiting our website, bloodcancers.ca, or by calling us toll-free. Please note that a short survey will be sent to all participants after this presentation, and we hope that you can take a moment to respond as it helps us plan future events. Thank you so much for being with us today, and take good care of yourself.